Is June 15th. It is World Elder Abuse Awareness Day. This day is celebrated throughout the world as an opportunity to raise awareness of elder abuse and elder safety. My name is Michelle Mills. I'm Deputy Director with Baltimore County Department of Aging, and my co-host and colleague, Lynn McCamey, is our Program Manager for the Ombudsman Program. And we are both co-chairs of the Baltimore County Restoring Elder Safety Today Coalition. And today we'd like to give a little bit of information and presentation on elder abuse and elder safety in honor of World Elder Abuse Awareness Day. And I'm going to have Lynn talk a little bit about a video that we're going to show.
Good afternoon to everybody. Thank you for joining us on our platform, Get Involved, Get Safe. We're going to show you a short clip of a video that really walks you through many of the stages of elder abuse. I know it might be fashioned from a different state, but elder abuse is elder abuse, and we will be providing for you some resources that are right here locally in Baltimore County. So stay tuned, and here is our video.
There was this big bruise on my friend's face. I told myself she'd fallen. I didn't want to see it. I didn't want to think her own nephew could have hit her.
I didn't want to see it. I didn't want to believe it. My mother's bank account was emptied, and a caregiver had taken control of it.
I didn't want to see it. My father's refrigerator. There was hardly anything in it. That's unusual for him.
My stuff kept disappearing, but I told myself I was misplacing it. I didn't want to see the truth. My daughter was stealing from me.
Many of us don't want to see the signs, don't want to see that a senior citizen is being abused, physically, emotionally, sexually, or financially. If you suspect elder abuse, call the police or your local agency on aging. You don't have to prove abuse is taking place to report it. Remember, elder abuse is a crime.
So see the signs, stop the crimes.
To learn more, visit ncpc.org.
Okay. So we know this can be a very sensitive topic, and it can also be emotionally concerning. So, but we do feel that it's just very important to share this so that folks really understand that we need to step up and help our elders if we think anything is happening. So these are just a little bit of some statistics on elder abuse. Elder abuse triples the risk of premature death of an older adult. Cognitive issues are a risk factor for all types of elder abuse. Abused older adults often end up in nursing homes. Statistics say 1 in 10 older adults experience abuse, but this number is probably low as many do not report and suffer in silence. These statistics show us it is important to get involved and help older adults get safe as our older population increases. And unfortunately, we think that only 1 in 23 cases are reported to Adult Protective Services. So the impact of elder abuse is really far-reaching. Premature death, suffering, nursing home, or hospital admittance increases with abuse. Financial abuse causes economic losses for older adults, families, and government programs such as medical assistance. Caregivers can also suffer mental and physical health issues and economic loss as a result of elder abuse. Elder abuse touches many aspects of all of our communities. So there's 5 different types of elder abuse that we're going to go over today. So elder abuse can really affect anybody. It doesn't matter their ethnic background, their gender, or their financial status. In other words, it can happen to anyone. It's often called hidden abuse because people often don't see it or recognize that it is happening. I'm going to turn it over to Lynn to talk about the different types of abuse.
So there are many strains of abuse out there, and this one talks about physical abuse. It can be pushing, shoving, biting, slapping, punching, or physically restraining someone, maybe even locking the person up. We also see that at times the residents or individuals might be denied the use of facilities or denied access to care. You may have over or under medicating, and actually sometimes the use of weapons. Physical abuse is really tough treatment or rough treatment or punishment that may result in pain, injury, impairment, or even death. These are really some serious pieces of the puzzle where older adults may not be able to be safe yet, even in their own environment. It can start out as just a level of abuse that's really on a low level, all the way up to something that is very harsh and fast acting on a daily basis for individuals. The next one is psychological abuse. Oftentimes, we think of verbal abuse or we think of name calling. Um, we also think that at times this is where intimidation and threats can come in. Abuse can be nonverbal, or psychological abuse can be nonverbal as well. It might be body gestures where someone is lunging at the person or pretending to hit them, just so you kind of are wielding a level of power over the older adult. It could be ridiculing someone's beliefs and what they're sharing. It could be a level of humiliation, making you feel as though you're not worthy of something, or that your words don't count, or that you don't even have a choice to be able to share what is going on. There's a level of isolation that can happen as well. Sometimes you may see the support systems or the caregivers denying access to friends, other family members, or not even letting them go out in public. They purposely are isolating them from the outside world so they can manage and manipulate things to the way they want them to be. And then there could be a level of stalking as well. The next one is probably one you hear about quite often. It's financial abuse. Financial abuse of older adults is an act um, where they are taking advantage of their funds. That can happen through the theft of Social Security, a pension check, maybe even your benefits, Medicare and Medicaid. Maybe also forcing or coercing the senior to withdraw funds. And these aren't even things that you want to purchase. These are things that you have access to. It's all what that support system is really wanting to make their lives more comfortably or have fun and engaging. There could be a level of deceiving an older adult so that way they're getting their money to buy personal things. It might be phone, it might be TVs, and all of these things can happen in person, over the phone, via the mail. A big one is using the computer. Computer scams are very, very high. We've seen a large variety of people stealing your identity, and then there becomes the financial ramifications of having someone else's identity. Last thing here is taking an older adult's property or their jewelry or their valuables without their consent. Sexual abuse is not one that we hear about as often, but it is still a major strain of elder abuse. And this is usually non consensual sexual contact that could actually range from actual forced oral or anal or vaginal intercourse. It could be that your home might be used as an opportunity for there to be sex acts happening. It could be rubbing or touching or fondling that's unwanted. It could be exhibitionism or forcing an older adult to view or to participate in pornography. There also could be sexual language that the older adult is forced to use in order to engage some of the necessary care or services that they might need help with throughout the course of the day. And the support system or the caregiver won't honor those things until some sexual act or interaction might happen. Neglect and abandonment. This is the failure to provide for the needs of an older adult. And these are some of the basics that we know. Failure to provide food, shelter, clothing. Their hygiene may not be taken care of. They may not have the appropriate tools to actually provide hygiene. They may be told that they can only take a shower or a bath once a month or some limiting rationing time frame. Healthcare systems also can bring a level of neglect and abandonment as well, and that might show up in not receiving the appropriate care in a timely manner, not getting assistance to eat your meals, not having designated individuals to provide actual care that you need to perform activities of daily living in that healthcare setting. There could be lack of social interaction. And last but not least, unfortunately, the older adult may be left alone for large volumes of time and they may not be able to process throughout the day. So decisions that they're making could be really harmful to them because there's nobody there to engage with them.
So now we're going to get into some warning signs of abuse. And I think, again, I wanted to reiterate that one of the things Lynn just went over about elder abuse, like it really is power. And it's a person having the power over someone else. And at its basic form, that is what elder abuse is. So we'd like to just go over a little bit again of some of the warning signs so that folks can be aware because it can be very, very subtle and maybe very hard to pick up. As you saw in the video, you know, an older person has a bruise, correct. You might just think they fell, right? They tripped down the steps, they fell on the sidewalk, never thinking that maybe they're a victim of abuse. So let's go into a little bit more of some of the warning signs. So we've got some tips or some bullet points here that we're just going to go over. So some of the warning signs, again, of physical abuse are repeated. It goes back to those unexplained bruises or injuries. And honestly, if an older adult goes to an emergency room with bruises, they will have forensic folks there who can tell the difference between a bruise that might just be from you hit your knee on a table or you know you just bumped into something versus something that has come from a blunt object, somebody hitting someone, someone punching someone. So there are ways that emergency room personnel can distinguish between what type of bruise it is. Open wounds, over medication, broken glasses, as Lynn mentioned earlier, lack of care, marks of restraints on wrists. These are just some of the signs of physical abuse. And then there's a change in a person's personality. They might be withdrawn. You might see somebody who was outgoing and wanted to chit chat all the time, and now they're just withdrawn. They want to not talk anymore. In fact, we just had a situation where when we gave this presentation earlier, one of the older adults said, "You know what? I haven't heard from my friend in a while. She calls me every week." Definitely reach out, right? What's going on? What are they experiencing? A person's withdrawal from normal activities, or maybe they're just acting fearful around certain individuals, can also be signs of emotional or physical abuse. You go into someone's home, you start to see large piles of unpaid bills, uncut grass, lots of junk mail, not having enough money. You know, maybe they're like, you know, I'm hungry. Well, did you go to the store? No, I don't have enough money. Maybe they can't cover their medication costs. Letters from the lottery, that's one of those big scams, are just signs of financial abuse. Again, the genital bruising, soreness, somebody who's diagnosed, you know, who's 70 or 80 years old with a sexually transmitted disease, that can all be signs of sexual abuse. So just some warning signs to look out for in those situations. So there really is no one explanation for um, the cause of elder abuse. We know that ageism exists, right? You see it in commercials, we see it in the movies, how older people are portrayed. So this is the stereotyping of older adults, right? They're infantile, they're senile, they lack capacity, social attitudes that cause that abuse as a family member or that one should not get involved only perpetuates abuse. Ignoring the problem or pretending that it doesn't exist will only increase elder abuse. Professionals and others need to educate themselves about elder abuse and spread the word. That's the only way that we're going to be able to get awareness up. It goes back to that old saying, see something, say something. And we're very appreciative that the Elder Justice Initiative, has put this presentation out here for us to use to hopefully inform more people, raise awareness, and get people to take steps to prevent and keep elders safe. But you also have to remember that folks do age differently. But old age does not mean Alzheimer's disease or lack of cognitive ability. And older adults have the same rights as do all of our society. So get involved when you see ageism, stereotyping, situations where abuse is likely, complain or speak up to assert the older rights right to respect. Prevent older abuse before it happens. And again, that's what we really want. We really just want to raise awareness and keep our elders safe in their community for as long as we can. Other causes of elder abuse. Sometimes, you have unresolved conflicts with families. We always talk about family dynamics and how that plays into family situations. That can contribute to elder abuse. For example, sometimes that problem child who isn't working ends up moving in and being the caregiver of the older adult. And the caregiver may start to take control of what the older adult and begin controlling finances. That older adult may have guilt, blaming themselves for the adult child's issues. Chances are, this older adult child has had problems throughout life, and maybe grandma has always helped that person out. And now, even though they're being taken advantage of, they feel bad that they don't want to let anybody know that their grandson or their granddaughter is taking advantage of them. Families that use violence to solve problems are also at greater risk. And some family members may feel that they're entitled to an older adult's inheritance and become controlling and abusive. Relationships where there's a history of domestic violence are also at greater risk for continued abuse. Unfortunately, for the abused older adult, they cannot bounce back from domestic violence as they may have when younger. Settings where there's mental health issues, or either the caretaker or the older adult provide a greater chance of abuse. Substance abuse. It's throughout our society right now. That opens the door to all types of abuse. That could be substance abuse either by the older adult or the caregiver. Addiction and the need for drugs or alcohol is an incentive to steal or harm an older adult for money or property. And then older adults with addictions may act out or become belligerent, increasing the chance for a violent altercation. Gambling is also a form of addiction and can lead to issues, whether the older adult is the gambler or a caregiver feeding their addiction by way of stealing funds. Ignoring abuse and pretending it is a family matter will only increase the odds of it happening. Child abuse and domestic violence cases were previously treated as a family matter, but now we need to really take those seriously. Acknowledgement of elder abuse is equally important. Keep your eyes open and watch for these types of signs. Get involved to prevent elder abuse. Perpetrators of elder physical abuse. There is no one profile of an abuser. Each community is different. Statistics from a study are on our slide showing that family members, unfortunately, are most often the abusers, followed by friends and neighbors, then healthcare aides. Some other types of abusers are new friends or new romances, such as those on the Facebook sweetheart scams. Be watchful for new friends who borrow money or need financial help from an older adult. We mentioned earlier that substance abuse, financial problems, mental health issues, and past criminal behavior are also risk factors for abusers. we're going to show a video now of our BC Rest Coalition and some opportunities for that. Stop sharing here. So again, Baltimore County Restoring Elder Safety Today is a coalition in Baltimore County. So, alrighty, we can go ahead and start that video.
Things you can do to prevent elder abuse.
Hello, we are Doug and Lynn from BC Rest, and here are 4 things you can do to prevent elder abuse.
Be aware of the possibility of abuse. Look around and take note of what may be happening. Does the individual seem withdrawn, nervous, fearful, sad, or anxious, especially around certain people when they have not seemed so in the past?
Keep in contact. Encourage the individual to talk to their friends, neighbors, and relatives. Maintaining communication will help decrease isolation. It will also give them a chance to talk about any other problems.
Volunteer. Become involved in a program that provides assistance and support for seniors and older adults.
Report suspected mistreatment. Report your concerns to your local Adult Protective Services agency, ombudsman, or law enforcement. Although a situation may have already been reported and investigated, if you believe circumstances are continuing or getting worse, continue to speak out.
We are a local coalition that is made up of professionals concerned about elder abuse that is working to educate and empower the community to identify and prevent elder abuse, neglect, and exploitation in Baltimore County through the development of strategic alliances, advocacy, and resource development.
For more information, contact BC Rest at 410-887-4200 or email ombudsman@baltimorecountymaryland.gov. Thanks for watching. Shine a light on elder safety.
So you've had a chance to learn a little bit about what is elder abuse, some of the common causes, the triggers, and who may be some of the perpetrators. We also want to share with you some extended resources. You heard Adult Protective Service mentioned in the video just a couple of minutes ago, and they do have a toll-free number that you could call. That is 1-800-91-PREVENT. And that will take you to the local jurisdiction, no matter where you are, for Adult Protective Services through the Department of Social Services. For those that are older adults in the community that might be being abused or be seen as vulnerable in what's happening around them. If you're in the long-term care setting, a nursing home or an assisted living, you did hear a number for the Ombudsman's program. That's an advocate for older adults that live in long-term care settings. You might also want to get connected to your local law enforcement, which then might lead you to the state's attorney's office. If there are issues with Medicaid and Medicare, you might want to go to Medicaid Fraud Control Unit. And then last but not least, and unfortunately, this is another level of elder abuse that we see happening, is human trafficking. So there is a hotline for human trafficking also, and that's 1-888-373-7888. There also are many other resources that are out there as well, national hotlines and national groups. I'm not sure if we can show that slide.
Sure can. Let me pull that up. Give me 1 second, Lynn.
Sure. What we want you to do is know that you can make a report at any time when you feel as though an older adult is being abused by one of those multiple strains that we talked about earlier today. You don't have to know or have all the facts. You just have to have a concern. You can also report anonymously. Then the Adult Protective Service unit or the Ombudsman's program here locally would do the formal investigations. Elder Justice is also another resource for individuals, and that website is up for us as well. Then we have the National Center for Victims of Crime. That is actually a really great one if you are a victim of crime and you need some assistance getting yourself back on track. They have the opportunity to assist with that, and their hotline is listed there as well. If you're suffering from psychological abuse and financial abuse, and domestic violence, you see those call numbers there as well. These are national programs. There also are local programs as well that might be able to give some assistance. If you're looking for bulk educational information and you too want to be a beacon of light and shine the light on elder abuse, you can contact the Consumer Fraud Protection Bureau, or you can yes, there it is, Consumer Financial Protection Bureau. And you see their website. They have lots of educational information that can be ordered in bulk and shared with any participants at a local senior center, at your church, at your community recreation program, or maybe within your family. Your family might want to learn those things as well. So here are a few other resources. If it is sexually violent abuse that's happened, there's a resource and hotline number there. If there are abandonment issues and neglect, you have the Consumer Voice. There's a resource there as well. We talked about Adult Protective Service, but the last link on there takes you to their national website. So if you know of someone who's out of state or maybe not in your respective neighborhood, but you know they're in a vulnerable status, that link there can get you to any Adult Protective Service throughout the 50 states. We want you to know that you can be safe no matter which way you turn.
So we want to thank everyone for joining us today. We've hit you with a lot of different information about elder abuse, what it is, the impact, warning signs, causes, who does it. We've discussed tips for preventing and intervening. Please remember to review our resources and see the Elder Justice Initiative website. They also have a tremendous amount of information out there. Get involved. Be a good ambassador. Be a steward of our older adults. Make sure they're safe. Make sure they're engaged. Make sure they're not isolated. Why is this man smiling? Well, he took the steps necessary to protect himself from elder abuse. Thanks again. Again, thank you for joining us on World Elder Abuse Awareness Day, June 15th. Look for other events going on the rest of this month. And thank you again for joining us. Be well, be safe, be healthy.
Be well, be safe, be healthy. I do want to share one last thing that the state of Maryland is taking a huge step, and they have formed an elder abuse task force that was just approved through Senate Bill 797, and it's due to kick off July 1st. So stay tuned. Maryland is a leader again in attacking elder abuse and the education and prevention of it. Have a great afternoon, everybody.
Thank you.